What if the fatigue, memory problems, balance issues, or poor sleep you've been blaming on aging aren't caused by aging at all? What if one of your medications is quietly creating those symptoms without you ever realizing it? Many adults over 60 are surprised to learn that some of the symptoms they accept as a normal part of getting older may actually be medication side effects. According to information from the National Institute on Aging, medications can sometimes cause problems that look remarkably similar to age-related decline. Today, we'll explore 7 hidden side effects that doctors and patients sometimes mistake for aging, why they happen, and what you can do about them. Stick with me until the end, because number 7 affects millions of seniors and often has a simple solution. Let's begin with an important reality. Many adults over 60 take multiple medications every day. This is often called polypharmacy, which simply means using several medications at the same time. For many people, these medications are necessary and beneficial. They help control blood pressure, manage cholesterol, reduce pain, improve sleep, and treat other health conditions. The challenge is that as the number of medications increases, the risk of side effects and drug interactions rises as well. Research shows that many seniors take 5 or more medications daily. When several medications are working inside the body at once, unexpected symptoms can appear. The problem is that these symptoms often develop gradually, making them easy to mistake for normal aging. Hidden effect number 1 is chronic fatigue. Many adults assume that feeling tired all the time is simply part of getting older. Sometimes it is, but medications are often part of the story. Certain beta blockers used for heart conditions and blood pressure may slow the heart rate and reduce energy levels. Some statins may contribute to feelings of fatigue in certain people. Even common antihistamines can cause lingering drowsiness. Imagine you're 68 years old. A few months ago, you enjoyed gardening every morning. Now you feel exhausted by lunchtime. You assume your age is catching up with you. But what if a recently added medication is contributing to that change? When fatigue appears after starting a new medication or changing a prescription, it's worth discussing with your doctor. The timing can provide important clues. Hidden effect number 2 is memory fog and confusion. Many seniors worry about memory loss. Forgetting names, misplacing keys, or losing focus can be frightening. However, certain medications can affect thinking and memory. A group called anticholinergics is particularly well known for this. These medications are found in some allergy products, bladder medications, and sleep aids. Benzodiazepines, which are sometimes prescribed for anxiety or sleep, may also contribute to confusion, slowed thinking, and memory difficulties, especially in older adults. The reason is fairly simple. These medications can affect chemical signals that help the brain process information and form memories. If you've ever felt unusually foggy, forgetful, or mentally slower after beginning a medication, that connection deserves attention. And that brings us to hidden effect number 3, balance problems and unexplained falls. Falls are one of the biggest health concerns for adults over 60. Many people assume balance naturally worsens with age. While some changes do occur, medications can play a major role. Sedatives can cause drowsiness and delayed reactions. Blood pressure medications may sometimes lower blood pressure too much, especially when standing up quickly. Certain antidepressants may also affect balance and coordination. Imagine waking up during the night. You stand up to use the bathroom and suddenly feel dizzy. That brief moment of instability may not be age alone. It could be a medication effect interacting with changes in blood pressure or alertness. Falls can lead to serious injuries, which is why any new balance problem should never be ignored. Hidden effect number 4 is muscle weakness and aches. Many adults describe sore legs, weak muscles, or difficulty climbing stairs. Again, aging often gets the blame. But some medications may contribute to these symptoms. Statins, which help lower cholesterol, can sometimes cause muscle discomfort in certain individuals. Diuretics, often called water pills, may affect fluid and mineral balance, which can influence muscle function. You may also hear discussions about CoQ10, a natural compound involved in energy production within cells. Some researchers have explored possible links between statin use and reduced CoQ10 levels. The science is still being studied, but it's a conversation many doctors are familiar with. If you've noticed increasing muscle weakness after starting a medication, don't assume it's simply age-related decline. Before I get to number 5, which honestly surprised me the most, let me show you something important. Many medication side effects don't arrive suddenly. They creep in slowly over months or even years. Because the changes happen gradually, both patients and healthcare providers can miss the connection. That's why paying attention to when symptoms started can be incredibly valuable. Sometimes the timeline tells a story that symptoms alone cannot. Now let's move to hidden effect number 5, chronic constipation. Constipation is one of the most common complaints among older adults, yet medications are often a major contributor. Opioid pain medications can slow movement through the digestive tract. Calcium supplements may contribute to constipation in some people. Iron supplements are another common cause. Anticholinergic medications can also reduce normal digestive activity. Picture a 72-year-old who begins taking an iron supplement. Over the following months, bowel movements become less frequent and increasingly uncomfortable. The person assumes digestion is simply slowing with age. In reality, the medication may be playing a significant role. Simple adjustments, dietary changes, hydration strategies, or medication reviews may help. Of course, talk to your doctor before making any changes, especially if you take medications. Hidden effect number 6 is low mood and depression. This one often surprises people. Most of us think of medications as treating health problems, not creating emotional ones. Yet certain medications have been linked to mood changes in some individuals. Some blood pressure medications may affect energy and mood. Steroids can influence emotional stability. Certain heart medications have also been associated with mood-related side effects in some patients. Imagine feeling less interested in activities you once loved. You stop attending social gatherings. You feel emotionally flat and assume it's simply part of aging. Sometimes the explanation may be more complicated. When new emotional symptoms appear after starting a medication, it's worth having a conversation with your healthcare provider. Mental health deserves the same attention as physical health. If this is helping you, a quick thumbs up really helps this channel reach more people your age. Now let's discuss hidden effect number 7, nighttime bathroom trips that ruin sleep. Many seniors wake up multiple times during the night to urinate. Poor sleep follows. Fatigue increases. Memory suffers. Mood declines. In some cases, the timing of diuretic medications may be contributing. Diuretics help the body remove excess fluid. That's their job. But if they're taken later in the day, they may continue working during the night. The result can be repeated trips to the bathroom when the body should be resting. Many people never realize that timing may matter just as much as the medication itself. Sometimes a conversation with a healthcare provider about scheduling can make a meaningful difference. Now let's talk about a concept called the prescribing cascade. This happens when a medication causes a side effect, but the side effect is mistaken for a new medical problem. A second medication is prescribed to treat that side effect. Then the second medication causes its own side effects, leading to additional prescriptions. For example, a medication may cause swelling. Another medication is prescribed for the swelling. That second medication creates dizziness. Then another medication is considered for the dizziness. Over time, the original cause becomes difficult to recognize. This is one reason medication reviews are so important. Every adult over 60 deserves a thorough medication review at least once a year. During this review, ask your doctor or pharmacist to look at every prescription, every over-the-counter medication, and every supplement you're taking. Questions such as, do I still need this medication? Or could any of my symptoms be side effects? Can open valuable conversations. You may be surprised how often healthcare providers appreciate these discussions. In fact, this connects to a growing movement called deprescribing. Deprescribing does not mean stopping medications on your own. It means carefully evaluating whether certain medications are still necessary and whether the benefits continue to outweigh the risks. Many doctors welcome these conversations because medication needs can change over time. What made sense at age 55 may not be the best option at age 75. The goal is not fewer medications at all costs. The goal is the right medications for your current health needs. Today's message comes down to 3 important takeaways. First, many symptoms commonly blamed on aging may actually be medication side effects. Second, taking multiple medications increases the chance of side effects and interactions, making regular reviews extremely important. Third, never assume a new symptom is simply part of getting older without discussing it with a healthcare professional. Most importantly, never stop a prescribed medication without medical supervision. Some medications must be adjusted gradually and carefully. Getting older does not mean accepting unnecessary fatigue, confusion, poor balance, or sleepless nights. Sometimes the problem isn't age at all. Sometimes it's a hidden medication effect waiting to be recognized. The more informed you are, the better equipped you become to protect your health, maintain your independence, and enjoy the years ahead with confidence. Subscribe for more videos like this every week, and let me know in the comments which tip you're going to try first.